Hello everyone, myself Alex Nampui, a veterinary student of 4th professional year of Lakhimpur College of Veterinary Science. So, today my topic of presentation is Amphistomiasis. These are the contents of my presentation. Introduction. Amphistomiasis is a parasitic disease mainly of livestock animals. It occurs more commonly in cattle, sheep and goat. This disease is caused by migrating paramphistom flukes. Its synonym is stomach fluke disease. This disease has economic losses in livestock due to its poor production of milk, meat and wool. The adult parasites are shaped like a pear and they grow up to a length of 15 mm long and are pink or red in color, whereas the immature flukes are generally found in the duodenum of the small intestine and they grow up to 1 to 3 mm long. The picture here is of an adult parasite that are attached to the lining of the rumen. Next up is the etiology. Amphistomiasis in farm and wild mammals is due to infection of paramphistoms such as the species of Paramphistomum cervi, Paramphistomum goti, Cotylophorone cotyloforum, Chelicophorone chelicoforum, Gigantocotyle explanatum, Gastrothylex cruminifer, and lastly Physiodurus elongatus. Next is the epidemiology. Okay, let's look into the distribution and incidence of the disease. Outbreak occurs more commonly in drier months, immediately after rain or flood, when the pastures are heavily contaminated with encysted cercaria. Planorbid snails are the intermediate hosts. They multiply rapidly in warm and watery environments. All ages of cattle, sheep, goats and wild ruminants, those that are grazing near water, may be affected, but younger animals are more susceptible than older ones. Older animals, instead of suffering, they act as carrier because of age or maybe development of certain immunity. However, they help spread the eggs all over the area. The picture above is of a planorbid snails, that is the intermediate host. Pathogenesis. Eggs are passed in the feces and miracidia are hatched in the water and they infect the planorbid snails. Development of sporosis, radia and cercaria occurs inside the snails, and the free-swimming cercaria insist on aquatic vegetations. In the ruminant host, the young flukes exist and remain in the small intestine for 3 to 6 weeks before migrating forward to the reticulum and to the rumen. Maximum and severe pathogenesis is caused by the immature flukes, particularly in duodenum and ileum. Adult flukes are non-pathogenic and they do not cause overt disease. The immature flukes cause severe hemorrhage from the point of their attachment and penetrate as far as to the muscularis mucosa. In severe cases, frank hemorrhagic duodenitis may occur, which is caused by the deep embedding of the parasites. Also in cases with Gigantocotyle explanatum, which affects the bile duct, gallbladder and sometimes duodenum, there may be superficial hemorrhagic spots indicating the point of attachment of the fluke. In heavy infection, the liver may also be affected, showing paleness of liver and even fibrosis. Okay, next is the clinical signs and the symptoms which is shown due to this disease condition. The clinical condition caused by immature parasite is known as immature amphistomiasis. Persistent fetid diarrhea. The diarrhea have a very foul-smelling or stinky diarrhea. Bottle jaw. It is a soft, floppy swelling of tissues underneath the jaw, or we can also say the accumulation of fluid. This condition is also called brisket edema. Emaciation. The animal becomes very thin and weak. Next is dehydration. There is heavy loss of body fluid or inadequate intake of fluid required by the body. Animals become very thirsty and drink frequently. Depression, pale mucous membrane, anorexia, followed by sudden death. The immature flukes attach to the duodenal and at times the ileal mucosa by means of a large posterior sucker and cause severe enteritis, possibly necrosis and hemorrhage. Extensive mortality may occur, especially in young cattle and sheep. You can see here the animal is very emaciated and is also having a rough body coat. Also there is persistent diarrhea because of the parasitic infection. Next picture is the bottle jaw condition. As seen in the picture, there is a soft floppy swelling underneath the jaw, or also called the brisket edema. In this picture, the animal is showing signs of pale mucous membrane. The animal is totally anemic. Comes through the diagnosis. Let's see how we can detect the disease. Number 1. History and clinical signs. Symptoms of diarrhea, emaciation, severe enteritis, and bottle jaw condition helps diagnose the disease. Examination of fluid feces may reveal immature flukes. Diagnosis is mostly made at necropsy. It shows marked enteritis along with large number of immature flukes in the small intestine. Differential diagnosis. This parasitic disease can be confused with other disease which shows almost the same signs and symptoms. Number 1. Infectious enteritis. Its synonym is gastroenteritis. These are usually accompanied by fever, and infectious enteritis is an acute disease. In infectious enteritis, the small intestine is inflamed and it causes gastritis or colitis, that is, inflammation of the large intestine. Number 2. Jones disease. Mostly in older animals, but this is a much more chronic disease. This disease is contagious. The appetite here in this disease is maintained, whereas in Amphistomiasis there is anorexia. Finally, the treatment. Let's see how and what drugs are effective for the treatment of this disease. Amphistomiasis is considered a neglected disease with no prescription drug for treatment. It is mainly on control of snail population. Few drugs that help in the treatment are 2 doses of oxyclosinide at 18.7 mg per kg body weight, 2 days apart, gives consistent result against immature paramphistomes in cattle. Niclosamide at 160 mg per kg body weight, as single dose or as 2 doses, 3 days apart, is effective. In cases of sheep, niclosamide is given at a little lower dose, that is at 100 mg per kg body weight, has good affinity against immature flukes. The image attached are few commercially available drugs. Combination of oxyclosinide and fenbendazole, which comes with a brand name of Clofen. Oral suspension of oxyclosinide as Oxycen, niclosamide bolus as Niclosen, also niclosamide tablets as Niclocel 500. Lastly, the prevention and control. How can this disease be controlled or minimize its occurrence? Number 1. By control of snail population by 3 different ways. A. Biological. Propagation of some plants like soapberry, shisakai inhibits the growth and reproduction of snails. Duck rearing. Ducks may consume large number of snails of the pond. B. Mechanical. Removal of vegetation, drainage of swamp and other breeding places of snails. Removal of snails through fishing net. C. By use of copper sulfate. Number 2. Therapeutic control of drugs. In areas where paramphistomes are a regular problem, a treatment between the seasonal peaks in the availability of metacercaria will reduce the number of eggs falling on the pasture and hence minimize the opportunity for snails to become infected. Number 3. Management. During outbreak, it is essential to remove animals from the infected pasture. Discourage grazing on green pasture surrounding tanks, ponds, pools, and bank of river. And the animals should be restricted on high lands, particularly in amphistome-prone areas. Number 4. Immunization. In South Africa, immunizing agent has been developed against paramphistomes, but in India, it has not developed yet. So here we have come to the end of our discussion, and the information stated have been gathered from different sources: the Merck Veterinary Manual, a textbook on preventive veterinary medicine by Amalendu Chakrabarty, Wikipedia, and Veterinary Parasitology by S.C. Mandal. Thank you everyone.